My name is Ariela. I'm from Faculdades Pequeno Príncipe in Curitiba, Brazil. I'm also the local president of IFMSA Brazil FPP, the committee of my university. And I'm glad to be hosting this webinar with you guys. So to start, I'm going to ask for Dr. Rogerio from the Department of the Internationalization Nucleus of Faculdades Pequeno Príncipe that is supporting this event to give us a small lecture. So Dr. Rogerio, you can start.
Okay, thank you. Dear participants, first of all, thank you for the invitation. As I have only 5 minutes to talk about the internationalization department of my institution, I try to be very synthetic. Chers participants, tout d'abord, merci pour l'invitation. Comme j'ai seulement 5 minutes pour parler de l'internationalisation de mon institution, je vais essayer d'être très concis. Liebe Teilnehmer, zunächst einmal vielen Dank für die Einladung. Da ich 5 Minuten Zeit habe, und über die Internationalisierung zu sprechen, werde ich versuchen, sehr synthetisch zu sein. Okay, my name is Rogerio Vaz. I'm the manager of the International Department of Faculdades Pequeno Príncipe, or Pequeno Príncipe College, as you wish. In Portuguese, Faculdades Pequeno Príncipe. So, Faculdades Pequeno Príncipe is one of the most important institutions dedicated exclusively to health education in Brazil. We actually have only 5 undergraduate health programs, to mention medical sciences, nursing, biomedicine or biomedical sciences, pharmaceutical sciences, psychology. And we also have more than 10 postgraduate programs, lato sensu, for instance. I talk about them a little bit. In a medical residency, with the oldest one with 70 years old, and multi-professional residency programs, biomedicine, pharmacy, psychology, nursing, they are more recent. One master program in education in health sciences. I am one of the lecturers and researchers of this program. One master and a PhD program in biotechnology, molecular biology applied to child and adolescent health. This is why, because we have the oldest pediatric hospital in South America, our hospital, Hospital Pequeno Príncipe Hospital, pediatric hospital. I just already told you about this, the 5 programs, and now the specialization courses, audit of hospital services, hospital and health psychology, clinical pharmacy, nursing with emphasis in pediatrics and newborn intensive care, health management, urgency and emergency, molecular genetics and biology. I'm the coordinator with hematology, hemotherapies applied to transplants, and third sectors entities management. The mobility, we have this mobility program, which is IFMS is included in our institution. The main purpose is to facilitate knowledge and technology transfer. So we send students abroad and also receive invited speakers, researchers, lecturers, and so on. So from 2011 till the last year, 2019, the internationalization already had 20 undergraduate students abroad. The countries that you can see is Canada, Spain, UK, USA. The majority of students have been there. Germany, Australia, Italy, and the last 2 years, University of Porto in Portugal. So those exchange programs, they were very important. The students, when they return, the first thing they have to do is to multiplicate the knowledge or the experience they lived abroad. And then we invite professors from abroad, where the institutions they stayed, for webinars and projects. that of mutual interest. For instance, the next one I'm displaying is Dr. Cheyenne Pierce Cutler. She started a research project with us about 2 years ago in a 3D bioprinting of organs and tissues, and we actually have one 3D bioprinter actually in our institution. The other professor who came here due to this purpose was Dr. Isabella Scarancini from the University of Alabama in Birmingham, USA, with several projects in neurosciences. And the last one of visiting scientists, we have several projects of mutual interest. Actually, in one, we have one medical science student, Andressa Junckes. We are just publishing another article. Dr. Alexander Bierbreuer, he used to belong to the Albert Einstein School and Cornell University, both in New York, and he's also involved with two projects we have here between our institution, Federal University of Minas Gerais, where he's actually now, and these two universities in the United States. We had already 5 webinars promoted by his lab with my intervention. In 2017, our institution built an internationalization policy with the objective of stimulating internationalization actions. And in this sense, with internationalization, we intend these main topics: train citizens and professionals, insert in global community, promote, support internationalization as achieve excellence in academic and scientific activity, promote interculturality, this is a very important one, not only science and clinical aspects, establish international cooperation, which already we have been doing for more than 5 years, disseminate the concepts of belonging and global responsibility. And currently, the Internationalization Center is coordinated by me. And if you like to contact me, this is my email and the link of my department. So, as I told you, our oldest department is not department, institution is our pediatric hospital, Pequeno Príncipe Hospital.
Dr. Rogerio.
1 minute? Okay. So, and the Pelé Pequeno Príncipe is another part of this complex, Faculdades Pequeno Príncipe, the hospital, and the research institute. These are the research lines, research areas. It's attracting several students from abroad to stay here with us and participate in these research areas: complex oncogenetic diseases, epidemiological, clinical, educational studies. This very important one: image radiology protection, neuroscience. I have a project here: microbiology, infectious diseases, cellular and pharmacological therapy, molecular medicine. And we have one very important one. Dr. Carolina Prando is a physician and researcher. She's involved in the COVID human genetic effort. Is a worldwide research project. So this is all the other institutions. We have cooperation agreements. There are several all over the world. And this is the image of our hospital, completed last year, 100 years old. So students coming from abroad, they are very welcome to participate in on these 3 areas: hospital, institute, and our Faculdades Pequeno Príncipe. And not only for mobility, but for, as I mentioned before, knowledge and technology transfer. You're more than welcome. Thank you.
Thank you, Dr. Rogerio.
Okay.
Okay.
I leave?
Yes, please. Thank you so much for your
Bye-bye.
presentation. I'll just...
Bye-bye.
So I think it's with me right now. And firstly, I wanted to present myself. I am Mariana Martins, the National President of IFMSA Brazil, and also the past new out of IFMSA Brazil. Firstly, I wanted to congratulate the local committee of Faculdades Pequeno, Príncipe for this initiative, because it's an amazing way of working global health during the pandemic crisis, and even without having physical exchange, we can exchange ideas. So as I told you before, I am responsible for this huge organization, which is the first affiliated organization in Latin America on the International Federation of Medical Student Associations. We have all the standing committees active, so we work with public health, with medical education, research exchange, professional exchange. We also have a special standing committee responsible for national exchange. Also, we talk about sexual and reproductive health. And for sure, we are developing too many activities with the standing committee of Right, Humans, and Peace. We also have special divisions to work with capacity building, research and publication, and also national programs which manage more than 1,000 campaigns and projects yearly. Currently, we have something around 166 LCs and more than 7,000 members and lots of alumni. And Brazil is so huge that could fit twice into the European Union. So in order to manage so many LCs, we are divided into 8 regions that are coordinated by the regional coordinators, and they have their own team, the regional team. In IFMSA Brazil has lots of partnerships and collaborations with UNFPA, in which we develop important capacity building events and opportunities of leadership skills improvement. Today we are going to exchange ideas. So as a past exchange officer, I'll talk about our exchange program, which is an important tool to promote intercultural learning, global health, social accountability, critical appraisal, and to expand the horizons of future health professionals. So our exchange program is recognized on the international level. So we collect prizes due to our academic quality, in which many of our local committees develop the pre-departure trainings, the preparation of our students for their exchange program, which is standardized, and it was published on the MSI, which is the international magazine of IFMSA. We also have our own magazine, and we increased it a lot during this time of pandemic, the involvement with science and evidence-based medicine, as long as the exchange program are affected by the COVID crisis. So right now we are developing an international campaign based on fake news with ANEM Portugal, and also we have done a huge survey in which we collected 13,000 answers on the national and international level. We talk about the role of the medical student during the pandemic. So that's basically in general line what we do as IFMSA Brazil. And if you are interested on our exchange program, you can access our media, our social media on Instagram and also IFMSA website, because we develop a point-based system. Our outgoing selection is pretty fair, and it's developed on a special platform. So you can compute our regulations and all the rules of the selection. And we have selections monthly, but the beginning of the season of the outgoing selection season is in September. So you can approach every local committee or contact us on the social media. And lastly, but not least, I want to leave my moment here saying that IFMSA Brazil is an amazing LOMO that say that we are the medical students who make the difference. So I hope that today, with our amazing speakers, we can be future health professionals who are going to make the difference on our health system. Thank you so much.
Thank you, Mari. Okay, now I would like to ask for the SISM to present.
Yeah, I think it's my turn.
Yes, you can present yourself, please.
Okay, sure. Good evening, bonsoir to all the Europeans, and good afternoon and bon après-midi to the Brazilians. Thank you for having invited me here. I'm Frederico Passerini, the National Officer on Research Exchange for the SISM Italy, and I'm here to present my organization with Flavia, the National Exchange Officer. SISM Italy was born 50 years ago, and it is an active NMO member inside the IFMSA. We have 39 local committees, which means that we are present in almost all the medical universities in our country. We promote different teams to create medical doctors more prepared for the future challenges of the world. And in particular, Flavia and I work on exchanges all around the world. But to know better what we do, I will leave her to explain how it works, our process.
Hi everyone, I'm Flavia Taglioni, and as Federico said, I'm the National Exchange Officer for Outgoings of SISM Italy. I really want to thank all the speakers involved in this webinar, especially Melio, Francesco, for the invitation. As SISM Italy, we signed 667 bilateral contracts for Scopy and 115 for SCORI during the last August meeting in Taiwan. According to our NMO's policy, we don't sign unilateral contracts for outgoings, but only for incoming students, and only with NMOs having socio-political issues. Even if we have a huge number of contracts each year, we are quite strict in our outgoing selection process. Every local community organizes its own selection following our national Scopy and SCORI regulations. The process starts at the beginning of November and it ends at the end of the month. Our selection is based on English, French, or Spanish oral test for a maximum of 60 points. Grade point average, and the Italian grading system goes from a minimum to 18 to a maximum of 30. Then we have a maximum of 7 points based on how much you're involved in the organization of the exchange season and in the association activities more in general. And then a maximum of 2 points for scientific publications. Capacity building is really crucial for us, and in order to guarantee a good level of academic quality, all our outgoings and incomings should participate to pre-exchange trainings and upon arrival trainings. We don't have national pre-exchange trainings because of our numbers, but we have trainers, IFMSA trainers, in each local committee, providing local exchange pre-exchange training to our students, teaching important tools about ethic on exchanges, intercultural learning, social determinants of health, and global health, which is a priority for SISM Italy. We usually organize a national Scopy and SCORI meeting with all the Leo and Lori, so the local officers, who are about to start their terms, which is a very important moment to share all our values and the vision and the mission of Scopy and SCORI. Due to the situation we are all living and the restriction we all have to follow, we have to rethink the way we usually handle our term as national exchange officers. And that's why, with the help of all our national officers of SCORA and all the other areas of FMSA, and our national coordinator for capacity building, we organize an online capacity building plan called Norton Plan. And every day for a month and a half, we have been talking about different aspects of pandemic. Even though this exchange season situation is very unstable at the moment, we keep being very positive and we'll keep making evidence-based decisions for our exchanges. Thank you.
Thank you guys so much. Now I would like to ask Ramona Doetsch from Switzerland to speak a little bit from SWIMSA. Ramona?
Yeah. Hi, my name is Ramona Doetsch and I study at the University of Basel in Switzerland. And I'm not actually an active member of SWIMSA, the Swiss Medical Students Association, but I'll be speaking on behalf of the exchange officer, Felix. So the SWIMSA is the Swiss Medical Students Association, and it connects all of the medical students in Switzerland, which are around 7,000 to 8,000. All of the medical faculties are involved in SWIMSA, and they have their own committees, but SWIMSA represents them. They have a lot of projects and they do a national coordination. They have seats in different organizations. And for example, now they formed a COVID task force. Twice a year they organize the SMSC, it's called. It's the Swiss Medical Students Convention for the medical students, and they have workshops and lectures there, and you can meet other people from Switzerland who study medicine. And I was asked to talk about what changed for the SCOPI and SCORI programs. And yeah, so they have professional exchanges from SWIMSA and research exchanges. And for the professional exchange, you have to speak either German or French. And for the research exchange, also English is possible. And they have a really high academic quality because the professional exchange programs are the same programs that we do in our clinical rotation in our 5th and 6th year. And they do a lot of teaching, and you can really do a lot, and you don't always have to watch. Yeah, you don't really. And because of the COVID pandemic, up until the end of July, they've canceled all of the programs. And in August, they've decided to do that just people who are from inside of Europe will be able to come and go outside of Switzerland. So there's a few reasons for that, why there's no one from outside of Europe can come. It's because of the flight connections, the visas, and even like the question if the borders are going to open. So they've decided to just let in people from inside of Europe. And after that, they don't really know yet how they're going to do it, but they'll see. It's like that anyway, that most of the people who come from foreign exchange come during the summer holidays, because a lot of students are on their holidays then. Yeah.
Thank you, Ramona, for speaking on the behalf of SWIMSA. Now I would like to call Faissal Hajar. He is a medical student at University Federal of Paraná, located in Curitiba, Brazil, and he will be talking about the Brazil Panorama. Okay. So, Faissal.
Okay, I'm presenting. Can you guys see my screen? Is it working?
It's going.
Okay, tell me when it worked.
Yes.
Okay, perfect. So, hello guys, good afternoon for the ones in Brazil, and for the ones I think it's good morning. So my name is Faissal Hajar. I'm a medical student, a 4th year medical student at Universidade Federal do Paraná. And I'll try to give a general panorama for the Brazilian situation, as well as how my university is dealing with this pandemic, as well as some final considerations about mental health and some more personal matters. So let's start. Let me see. Okay. So I'm currently based in Paraná, which is one of the 26 without the federal district states in Brazil. And we have a very, I would say, great situation here as far as we can tell, because Paraná is currently one of the best states dealing with this pandemic in terms of deaths and overall notified cases. And we had recently a lecture with our infectious disease professor, Clémence, who's currently the president for the Brazilian Society for Infectious Disease. And he pointed out some great points about Paraná and how we are dealing with this in both in a primary care situation as well as specialized care in the tertiary hospitals we have. So we had a rapid social distancing approach by the population without any official decision yet, which was back in the 10th of March. There are already people starting to apply some measures of social distancing, which I think helped a lot in the during the spread, the first spread of the pandemic without community spread. We had a huge engagement from our doctors and nurses doing voluntary shifts, studying the literature, making research, trying to communicate with the population as fast as possible. So it was a really like a global approach, I would say, at least like local approach, which helped us deal with this in the first days, really in a really organized manner. And also, I mentioned evidence-based medicine because nowadays we have a bunch of articles and papers every day, but we can define what's good literature and what's not right now, but we will in the future because we don't have many control studies. We do have some clinical studies, but without great control. So it remains the question here if we're doing the best, but we're trying to, and we are looking forward to change our practice according to new papers. So here's a very interesting message I received a couple of days ago. It was a friend of mine. He was asking me to explain the miracle we're having here in Paraná. I wouldn't call it a miracle, but this is some data that we need to explore, the reasons why we are reaching these numbers and how we're dealing with the problem. So here's a general panoramic view. This I updated a couple hours ago. It's from our health department here from Paraná. So global count, the global total cases are close to 5 million, and the deaths are close to 330,000. Brazil is kind of 6%, both in cases and deaths. And Paraná is almost in 3,000 cases and somewhere in between 150 deaths. We had a somewhat linear approach in the last days. We are following a more logarithm trend. We should be right on the knee of the curve, right here. Let me see if I can change my pointer here. Just a second. Here, yeah. So we should be, if we are following a logarithm curve, we will know by the end of 2 or 3 weeks from now, because we will see this point of inflection, as we call. But currently we are doing very great, and we have some data to explain this in a more comparative manner. So Fiocruz, which is a national foundation for research in health, has a project called the Big Data COVID-19 project. It's a very organized and interesting project that polarizes information and data. And I brought some graphs and some data from them. So here we have a general graph showing new cases by day, both in Rio de Janeiro and São Paulo. So the first thing that we might think when we see some graph like this, we see some peaks and bottoms, some valleys, right? This is mainly because of notification delay. So every time you have some notifications, it takes some time for people like on weekends and other days to notify the health department. And some days before they compile all this data and they bring it out to the public. So that's why we have this somewhat oscillating movement, but we see a general uptrend if we see the averages. But we see that São Paulo is very in a critical situation here. In the obits rate, we have some obits, new deaths by day as well. And so this is from the 11th of May. We were averaging 200 deaths per day in São Paulo and somewhat near in Rio de Janeiro. And if we see the log scale, we can see a more general vision of a trend. So we might see that we are trying to slow down, but usually when we see sigmoid curves and progressions, we see that usually the slopes, they follow a sigmoid curve. So they will follow a plateau, but they will eventually rise up, or if we're seeing a downtrend, they will try to rise down. So we might have some new spikes in a few weeks. We can't say just by looking at a logarithm scale curve that we are reaching a plateau. So this one is a very interesting curve, which you can see comparative analysis from all the 26 states plus the federal district from Brazil. And we can see general trend, uptrend in all of the states, mainly in São Paulo, which I like to point out, and Amazonas, which I like to point out as well, because they're having a very critical situation, both in infrastructure and in the health care as well. And we also have Paraná, as I mentioned, that is in a pretty great position right now, as we can say, which we are almost rising to a plateau in our curve. And a very interesting measure that we can see, also I'll show in the next slide. Here we can see the cumulative cases. So the darker it is, the closest to 1 million cases we have. And the lightest, the closest to 0 cases, which none of them have by now, because we are, this one is for the 14th of May. So they don't update this daily, but some of the graphs there are more up to date than others. So we can see a critical situation in São Paulo. We do have some problems of notification issues in some states, but in general, we have a very homogeneous strata in all states. So these graphs that I'm going to show you, they're very interesting because they offer a extrapolation and a supposition, as we say, of data. So we can apply the terms of Paraná as if all the states were like Paraná. So in the black trend, in the black line, we can see how Paraná is doing during these days as we have the data. And if we apply the same measures that were done in Paraná to the whole country, we would have this blue line. But currently, Brazil is in this red line. And as a comparison, we can apply the same measures, the same data that is being gathered in São Paulo to the whole country, and we will reach this next slide. There will be the blue line. So São Paulo is currently in this black line. Brazil is currently in this green line. And if we extrapolate this data, we will reach a national line, which will be represented by this blue one here. So it's a very interesting comment to be made that some states are doing better than others, but we still don't know why, but we can infer some things. And here are the rates for respiratory syndrome deaths. So currently reaching a spike, but also they're trying to follow a downtrend by the epidemiologic week. So now moving on to our university approach, I'll speak more on my university, which is Universidade Federal do Paraná, that is dealing with a somewhat different approach than some other universities. So currently we do not have official lectures by now. They're trying to plan. They recently published an announcement that they're going to buy computers for the students that do not have access to internet or have bad internet connections. But some teachers, they're trying to help us and trying to teach us with optional lectures, which will be then be more in-depth analyzed when this pandemic is more settled. So they're mainly worried with the students' rights, because every student must have the right to watch the lecture, even though he or she does not have internet connection. Because when you sign the contract to get in the university, you're granted access to lectures during the 6 years, which is the course in Brazil. So if you don't have access to internet, but professors are giving exams and all kind of different assignments online, and you don't have access, that's kind of an ethical flaw. So they're trying to work around this problem. But we also have a huge community effort by the university with research programs, some of which I'm involved, and also some voluntary work, which I'm also involved, but I'll comment on that later. And on private universities, I'll like Ariela to comment a bit, because she is on a private university.
So I'm from Faculdades Pequeno Príncipe, which is a private university. And like my university, many others private universities are doing online lectures by their own platform systems, or by Zoom, Skype, or other platforms that allow students to connect with the professors. We are doing some online exams. Most of them are for the theoretical part of our subjects. We are doing our practical exams when we come back We don't know exactly when this is going to be. They predict maybe can be June, but it's not like for sure. In my university, we use the OSCE or OSCE for the practical examination. And to summarize, most of the private universities are trying to maintain students active and studying by online classes, and trying to do their best to maintain the class. I think that's it. You can continue, Faissal. Thank you.
Great. Thank you, Ariela, for the explanation. Okay, let's continue here. A very interesting thing that happened a couple weeks ago was an early graduation event. So currently we have a bunch of students that were ready to graduate, but we were faced with this pandemic. So some people got afraid of if they were going to graduate or not, if it was optional or not. So they did a graduation event online. And the students with at least 75% of course completion, including just the last 2 years, were offered an early graduation. So this is an actual image from the graduation that happened. So it was kind of a symbolic event, but it did have official value. So here we have just some pinpoints on how we're dealing with mental health, on how I'm dealing with mental health. So I'm trying to help others with some voluntary programs that we have to reach out for people who are in need. I'm currently developing some research programs related to the COVID-19 pandemic. So we're trying to elaborate new knowledge and try to come up with some innovative ideas to deal with all of this. And also with optimism. So as I said during our training, there must be a good side for all this. I know it's a shame that many people are dying. We are having a real struggle to defeat this virus. But on the other hand, some people are spending more time with their families. Sometimes they do not have even the opportunity to do this because they live in another city, or they spend too much time on a hospital. And sometimes, mostly for students, right, who are not working, spending this time to reflect upon course careers and future plans. I think it's somewhat of a good side of all this. So I know it really sucks, this pandemic, but having a good side and thinking about the reflections and the time we can spend with our family, if this is possible, it's a great thing to do and to control mental health during all this struggle. And finally, I'd like to comment on our nonprofit project, which is called Juntos contra o Covid. You can access this platform through juntoscontracovid.org. In translation, it will be Together Against COVID, which is a website platform where people can fill up a form. And every 5 minutes, this data is updated on a real-time map. And we notify every user every 7 days so they can update their health status. So we can currently map some risk areas all over Brazil. We're currently more active in Curitiba, Paraná, but the map is active in any space in any locale here in Brazil. So we have some real great partners. We have Amazon, Clouser, Gebit, Across, Mapbox, which is currently the company that offers maps from Uber. So they're currently our partners. And also Totus Labs, which is the biggest IT company in Latin America. And the map is currently active, and it's inside a research program in Universidade Federal do Paraná. And we have partnerships with UTFPR, Universidade Federal do Piauí, o Complexo Hospital Pequeno Príncipe, e also Fiocruz. So we're developing some current research on the epidemiologic side and also the economic impacts of the pandemic. So I would really like all of you to look into this platform and maybe share if you like it. So thank you very much, Ariela. Thank you, all of the speakers. Have a nice day.
Thank you, Faissal. Now I would like to ask for Francesco Giorgio Giulio Mello He's a medical student at University Vita Salute San Raffaele in Milan, Italy. So, Francesco, feel free to share the screen.
Yes, a second. Okay, all right. So I present myself. My name is Francesco Giorgio Giulio Merlo Pic. I'm an Italian student at the Università San Raffaele in Milan. And I'm going to present the Italian situation from the point of view of the coronavirus pandemic. I'd like to thank all the members of this webinar for organizing it and for giving the opportunity to talk about this important topics from an international perspective. So I'd like to talk about what happened in Italy and give you a chronological evaluation of what happened from the beginning till now, and I'll talk a bit about the trends of the pandemic from an epidemiological perspective, and in the end, we'll give a resume of the situation that happened. So, at the beginning, on the 31st of January 2020, the first 2 cases of coronavirus appeared in Italy. There were 2 Chinese tourists that were touring in Rome, and they had the symptoms of coronavirus. They were taken to the hospital, isolated, and they were cured from the virus. And those 2 were the first cases in Italy. 1 week later, the government decided to repatriate Italian citizens that were living in Wuhan, which at the time was the epidemic center of coronavirus. And of those 56 Italian citizens, only 1 was affected. And this individual was considered number 3. The escalation took place around February 21st, and it started in Lombardy, which is a region in northern Italy. This region is one of the most industrialized regions in Italy, and it is known for having a lot of partnership with China. And this is one of the reasons why it's believed to be the first region to be affected by the coronavirus pandemic. But by March 22nd, there were, from 16 new cases, there was an increase by 60, and the government decided to shut down Lombardy. And by March 7th, the cases were up at around 1,500. And as you can see in the map here, all the regions in red, which are Lombardia, Emilia-Romagna, Veneto, Piemonte, and Marche, were partially, if not all, shut down in order to prevent a spread to the other regions of Italy. The spread eventually took place, and it was inevitable that a major epidemic situation would take place. And by March 11th, Prime Minister Giuseppe Conte decided to carry out a nationwide lockdown, blocking all borders and closing non-all essential business. As you can see here, the Corriere della Sera, which is Italy's one of Italy's largest journals and newspapers agencies, was promoting the fact that Italy was being closed. And in this photo here, we have Presidente della Repubblica in front of Arco della Patria, and this is a symbolic photo in our Italian history, I would say. So let's talk a bit about the progression of the pandemic. So by the 11th of March, as you can see in the graph here on the right, the cases were around 10,000. But by March 27th, so by the end of the month, there was an extreme increase in the contagion of the virus around the country. 65,000 people were infected, and around 10,000 people were confirmed deceased. So if we extrapolate this data, we can notice that the mortality or the case fatality ratio is really high. It's around 15%, while in China it was around 3%. So why is the death ratio so high? To explain this, there are four main reasons. So you can see this in this diagram, Italy compared to the rest of the world and other regions of the world, and we're reaching 14-15%, which is extremely high. And the reason is because Italy, Italian population is an old population. By old, I mean that 23% of Italy is composed by individuals of age 60 or above. And those individuals are the ones most susceptible to the virus. The next reason is that elderly in Italy are very active people. They like to socialize, they like to go to the restaurants, they like to go for strolls. They don't like to stay indoors most of the time. And this can increase the chances of contagion. The third reason is that something critical happened in the past 2 through 3 months in Italy regarding the contagion. Healthcare centers in Italy, especially in Lombardia, were targeted by the coronavirus infection. Around 6,000 people unfortunately died in those structures, and most of them were elderly, sick people. And this was a mishap due to the structures that were not well isolated. But the most important reason why there is such a high case fatality ratio is because of tests. Now you can see in the graph here, Italy in the blue line, and you can see how in the past month, the tests have been growing steadily, and now it's one of the countries that's testing the most. But I would like to put your attention at the beginning of the graph, here. Now here, we said around the 27th of March, here is Italy, and we can see that the number of tests is quite low compared to South Korea. I mean, South Korea were really efficient in carrying out tests for the population early on, and they managed to essentially block the pandemic. Italy struggled, and we know here at this time there were 65,000 individuals infected with only 5 tests carried out for every 1,000 people. What happened is that Lombardia and other regions decided to test only the symptomatic patients. And by testing only the symptomatic patients, the case fatality ratio increases. As we know, the case fatality rate is the number of deaths divided by the number of infected. And if we only test people who have symptoms, those people are the ones more at risk of developing a terminal condition that could lead them to death. So this data is not reliable. The fact that Italy is a 15% mortality rate, it doesn't tell the whole story, and is related to a policy that the regional government took to test people. Let's go to the next topic that I'd like to discuss with you, which is our hospital resources. From this graph, you can see that Italy has a steady ICU bed capacity of around 1,800 ICU beds available at all time in the whole country. At the time of the pandemic, you can see that the number wasn't enough to satisfy the needs of the people that had this respiratory infection. And by now, by mid-May and May, you can see that the trend is slowing down and that the capacity is being met again. The blue line shows the increased number of intensive care units that have been disposed through charities and other efforts to combat the necessity for having more beds. And you can see that there has been an increment by 2,500 beds, which has helped to meet this need for more units. The last point I'd like to talk to you about is the app Immuni. This app is a joint venture between Google, Apple, and the Italian government to monitor the spreading of the virus around Italy and to control this factor. It consists, as it says here, in a digital handshake technology between the phones of 2 individuals that come into close proximity, around 5 meters from each other, and it sends a encrypted data, privilege-free, so your identity is protected, to the government and to the Google and Apple platforms that alerts of the situation that there might be an infection spreading possibility. And this allows the government, but also Google and Apple to monitor the spread and the R naught values. And this is the situation at the moment. You can see that, and this is data comes from yesterday, that the number of deaths is quite high in Italy. It's the second highest after the UK. But something that's promising are the number of people who have recovered, which is a very nice information to have, and shows that something is being done to solve the problem. Something I'd like to note, make you note, is that the spreading and the clusters of the infection were not homogeneous in Italy. Most of them were found in the north, in Lombardia and Piemonte, and in Veneto, and in Emilia-Romagna. But you can see here, in the middle, you find Umbria. And in Umbria, it's interesting, there's only 22 people that have been infected, compared to the 86,000 people who've been infected in Lombardia, which is impressive to say the least. And now I'll talk a bit about the university approach. So Italian universities closed immediately when the lockdown was carried out at the beginning of the epidemic. And they took quick precautions to carry out lessons online. And some universities managed to create online lessons by March 2nd. And universities have in mind the most important points that they have in mind are scheduling the medical courses for next year, especially for 5th or 6th year students that are going to graduate soon. And those students also necessitate hospital internships and graduations, of course, which have been postponed. So this creates uncertainty. But those factors are being addressed by the universities. Improving the quality of online education. This point is especially important, and in order to maintain a quality of education and of teaching at high standards. Online examination has been carried out since the beginning. First exams were carried out at the beginning of April, and they're all oral exams. And soon enough, in July, it's believed that we will have the possibility to do written exams as well. Something about my own reality in Milan. I study at the Università San Raffaele, and which is in partner with the San Raffaele Hospital. What we did is through an open source fundraising project, the city of Milan managed to raise 4 million euros, which were used partially to create new ICU units in the hospital and in the university. You can see here in the image, this is the new ICU unit with 40 beds, and it was made out of the sporting center of the university. I would like to talk a bit about the charity foundations and fundraising events that have been carried out in Italy by Red Cross, Emergency, and other platforms that are helping individuals that are not able to provide food for themselves or shelter to survive this pandemic and this crisis situation. And something I'd like to mention that's been going on as of lately is Italy has entered phase 2 on the 4th of March officially. And phase 2 consists in a return to normality, quote unquote. I mean, a condition in which businesses are starting to open again. Families are able to visit each other again, even if they live in different cities. The lockdown is slowly coming apart. And as you can see, mobility is being reactivated, transportation around Italy is being reactivated. Museums and shops are also being allowed to open as of May the 18th. And restaurants and bars still have to, in some regions, still have to open up. But soon enough, we'll see the outcome of this opening, and we'll see if we're able to maintain this the trend that we're following right now, which is that of ending the epidemics. What am I doing? What are we doing in Italy to stay healthy in our homes and to enjoy ourselves in this moment of crisis. Hobbies, physical exercise, and socializing events are my suggestions and what I've been doing as of lately. I myself like to play guitar and to do sports. Every day I try to do some physical exercise to stay in the moment and to feel better about the situation. And obviously talking with friends and that are even far away is always a nice relief. And with this, I would like to thank you for your attention, and I'd like to thank the organizers.
Thank you so much for your presentation, Francesco. Now I would like to call Ramona Doetsch. She's a medical student at University of Basel in Switzerland, and she will be speaking about the reality in Switzerland. So, Ramona. Hi.
Yeah. Is it working?
It's going.
Okay.
Yes.
So, hi. My name is Ramona Doetsch, and I'm from the University of Basel in Switzerland. And I'll be presenting the Swiss view of the COVID pandemic. First, I'm going to talk about the government approach, which I've separated in like how many cases we've had, what measures the government has taken, and how they're easing them as of now. So we, first I want to say that Switzerland has a population of 8 million people. That's why in comparison to other countries, you have lower numbers. So we have around 30,000 cases. And it started at the end of February, and then it got worse slowly, and then it hit like the peak around the end of March. And as of now, there's only small numbers of new infected cases every day. Yeah. So for the deaths, we have around 1,634 deaths as of now, and you can see that it also mostly affects the old people of Switzerland. The most people who died are over 80, and you can also see that most of the large part of the people that died were male. And here is a map of Switzerland, which also shows you that different regions of Switzerland have been affected differently. For example, this right here is the Italian-speaking part of Switzerland, which has been greatly affected. So I'm going to talk really shortly about the testing. I've put the other countries here that are participating. And Switzerland has one of the highest ratings of testing. By now, Italy has more, but in the beginning we did a lot of testing as well. Even though the government put out some criteria that only people who have symptoms with risk factors or serious symptoms should get tested, and the other people with not severe symptoms, they should stay at home and do social distancing. So for the measures the government put in place, one of the first things they did was this campaign in all of the Swiss national languages and in English, which is just basically saying you should stay at home, you should keep distance from other people, wash your hands, don't shake hands, sneeze and cough into your elbow, and always call if you want to go to the doctor. So at the end of February, we had our first case, which was a man who was visiting Milan. And then a few days after, they've banned events of more than 1,000 people. And they've expanded that in March to 100 people. Then they also closed all educational establishments. So every school, all the universities. And they've partially closed the borders. They've only partially closed it because a lot of people from outside of Switzerland work in Switzerland, especially in the health industry. So we really do need these workers, especially in a pandemic. So that's why they've partially closed it. And this is a picture of the border to Germany. And at first, normally there's no fence here at all, obviously. And at first they only put one fence, but there were way too many people standing at the fence and they were way too close together. So they've put up a second one with 2 meters of distance so the people are not too close to each other. Then on the 16th of March, they've closed all of the non-essential shops and they've called out kind of like a lockdown. But it's never really been a lockdown like in other countries because you were still allowed to meet maximum of 4 people, which I'm going to come to later. But a few days after that, they also mobilized the military. And this has been the largest mobilization of the military in Switzerland since the Second World War. And they're using the soldier for the border and also in the hospitals where they're working. And there's also community workers helping there. So then a few days later, they prohibited meetings with more than 5 people. And this has been like the strictest measure we've had. So you technically were still able to meet 4 people, but you had to keep a distance of 2 meters. And the police did give out fines if you were not keeping these 2 meters, for example, in a park or something like that. So, and because the cases have become better and there have been less people infected, they've done like these 3 phases. And the first phase was in the end of April, where they've opened hairdressers and like garden centers, massage practices. Then on the 11th of May, they've reopened the primary schools, like sports centers, museum, libraries, and also restaurants. But you can also only go in there with 3 other people. And in June, there will probably be allowed a gathering of more than 5 people, and other educational institutions will open, which also includes universities, but that won't be like really a change for us because this semester is over by then anyways. And so I'll be talking about my university's approach now, which is the University of Basel in Switzerland. So for the lectures, we always have slides on our platform. And then they've done like additional things to add to these slides. So a lot of classes we have on Zoom, and then for some classes we have audio files on the presentation, we have video presentations, and one teacher even did like weekly Q&A sessions where you were able to ask him any questions that you had about the topic we were talking about. And oh yeah, I forgot to say that for the Zoom classes, the faculty organized like rooms in the faculty that the teachers can go to, and there's always a technician there helping them to put the slides on Zoom and how to coordinate it. And for the practical skills, they did some of them online, for example, the anatomy classes in the first year. And they will also be organizing courses next semester for the things we couldn't do. For the exam, I've listed like all of the years. For the 1st, 2nd, and 4th year, the exam doesn't count. They just have to attend the exam, but they won't get a pass or fail. They'll just have to attend. And for the 3rd year, there will be a grade and a pass-fail. But the OSCE exams, so like the practical exams and the neuroanatomy exam has been cancelled. And the state examination will take place as usual if they can keep it safe. Yeah, and there's also a second exam date for people who are in the military or are working a lot of shifts in the hospital who can't really study right now. So for the other universities in Switzerland, they're mostly also doing Zoom classes, podcasts. The exams have either been postponed or they're online. Yeah, it's similar to the approach in Basel. And what I'm doing to maintain my mental health, it really helps me like to have a daily schedule, to know what I'm gonna do, to really know what classes I need to attend. And I'm trying to do some sports, to have like something else to do. And I'm really doing a lot of Zoom calls with my friends. We've been really creative with like games we can play over Zoom, and it's really fun. And it really helps you to see something else than the COVID pandemic. Yeah. So thank you so much for your attention.
Thank you, Ramona, so much for your presentation. Now I would like to call Clémence Bouet. She's 23 years old, and she will be speaking in the behalf of Dorian Della Vittoria. He's 22 years old, a medical student in the Faculté de Médecine de Rouen in France.
Okay, so as Ariela said, I will present the situation in France in the behalf of Dorian, which is in medicine. So we made the presentation together, so I will present for him because he's not available. So I will start by showing you the statistics in France. We had 182,000 cases of coronavirus in France. You can see on these graphics the evolution of the situation between the 5th February and 2 days ago, the 21st of May. As you can see, the curve is more stable, so it means that the cases are like stable. And we had 28,000 deaths in France since the beginning of the pandemic, and 64,000 people recovered, so it means that they went back home. On these graphics, you can see the evolution in France day by day, and the number of cases that you can see on the orange graphic is like for yesterday it was only right here 393 people that were tested positives. And for the new deaths, which is in black, you can see that yesterday we had 74 deaths only. When you can see peaks, like big amounts of people, it is when the data of hospitals specialized for elderly people send informations. That's why you can see a big number of cases only on one day. On this slide, you can see the statistics in France. So you have on the left the map of France of yesterday, of the intensive care capacity by region. As you can see right here, this is Paris, and it means that the beds were at the capacity of 91% occupied. So it means that there is still 10% of the beds that are available for people to go and to be in the hospitals. As you can see in this map too, the region of Paris, the north of France, and the east of France were the places where the most cases of coronavirus has been contracting coronavirus. And on the right, the number of people that are currently hospitalized in France in each region. So in Paris, this is the biggest places where people get coronavirus, because this is the biggest city of France, and the number of people per meters is bigger than on the rest of country. This little graphic, you can see that the people that are older, so 80 years old, are more likely to die of coronavirus. That are statistics that are only from France, but it is the same tendencies in the rest of the countries. So I will show you a bit of the timeline in France. So everything started on the 15th of February, because the first death was confirmed, the official one. It was an 80 years old Chinese man that was back from a trip in China. And then on the 29th of February, the government banned the gatherings of more than 5,000 people. So it meant festivals, big events. And then on the 9th of March, it was the gatherings of more than 1,000 people. And then 5 days later, it was the gatherings of more than 100 people. And on the 17th of March, the quarantine, comes into force in France. Macron, our president, explained us on TV that we had to stay at home and that it was forbidden to go outside without a paper. I will talk to you about that later. And of course, the European Union closes its external borders. And after 10 days of quarantine, of being at home, we had a new speech on TV that Macron did. And he said that the containment was extended until April 15. And then, unfortunately, France had more than 10,000 deaths due to coronavirus on April 8. And then on April 10th, we had 6.9 million employees that were on short-time working, which means that they were working, not working anymore because of the economic situation. For example, people that were working at the restaurants or bars, they were forced to stay at home and forced not to be able to work. And then on April 13, we had another declaration on TV, and the president said that the containment was extended until May 11, so a month after. Then we passed the 20,000 deaths in April 20. And another important thing is that 40% of this number, so 7,000, I think, are deaths that were in EHPAD. EHPAD is something in France that is a house for elderly dependent people. So, for example, people that have more than 80 years old. And on May 4th, the France passed the 25,000 deaths. And on May 7, the first map of déconfinement, which is when the people can go outside, is published. So you can see on this map that the green regions are the regions where the end of the quarantine is really fast. So you can go outside without any problem. And then the red the word departments were the places where it was a bit slower. So Paris and the east and north of France. On May 11, so 2 weeks ago, we were officially out of quarantine. So we had the possibility to see the family, friends, boyfriends, and etc. But bars, restaurants, cinema, big shops were still closed. I will now move on the governmental approach. So what they forced us to do. So everyone had to stay at home. It is more strict than social distancing because you can just not go outside except for some really precise reasons. So the authorized displacements were going from home to work. It was allowed, but if you were able to speak on to be an home, it was possible to be an home office and not to go to work. You were able to go outside of home for food shopping, of course, but you had to have a paper for that. You were able to go to the doctor or the hospital. You were able to pick up your children or help a dependent person. For example, if you are working you are a nurse and you put your children in a kindergarten, you were able to pick them up, and also to take your dog out and to get some fresh air, but it has to be less than 1 hour a day and only in the neighborhood, so like a kilometers around. And the main rule was to add a document with you all the time. So this paper that you can see over there is a certificate of travel. And you had to check the reason that I said before to go outside. And on this one, it is like an easier paper, a paper that you can understand more easily. And this is for people that have mental illness. And you also had to have a professional card, for example, if you were a doctor or a nurse to go to the hospital, because it is a work displacement. And the biggest problem was if you were outside without this paper, you had a fine. So 135 euros, so 855 real, just because you were outside without this paper. So it's a lot. And now, because the quarantine ends, we can go outside, so we doesn't need this paper anymore, but we need another paper if we need to do a displacement that is more than 100 kilometers. We need this paper and the proof of your employer if this is a professional departure. And you also will have a fine if you don't have this paper and you're 100 kilometers from home. Okay, and then the important things that the government said during quarantine on TV and on the magazine, on radio, was that you had to wash your hands very regularly. You had to cough or sneeze into your elbow. You had to use a disposable tissue and dispose of it then after using it. You had to salute without shaking hand and without kissing, without doing la bise, which is very common in France. So it was really hard. And stay within 1 meter of each other, of course. And the signs of the coronavirus are over there. So fever, cough, fatigue, breathing difficulties, muscle soreness, sore throat, and so on. What was the university approach for the coronavirus pandemic? So they closed the classes from kindergarten to university on March 16, and they will reopen in September. but the school for little children will reopen on the 11th of May. But for the students, it is in September only. So, as the other speakers, there were some measures that were taken. So for the exam, it was online MCQ tests. And for the courses, it was lectures online that allows students to connect with the teacher, and the professor remain available to accompany and advise students. And another thing that is important in medicine is that students were working from home on this kind of books that you can see over there. So they were able to have everything with them at home. So it was easy. And what I am doing and what Dorian is doing for maintaining mental health, it is cooking, because gastronomy is really important in France. Calling friends, of course, on Zoom and on the phone and Skype and WhatsApp, and doing sports by following YouTube videos in the morning. And last but not least, what Dorian is doing to motivate himself to work is making video conversation with his friends, and everyone is working on his own. And he said it's a bit like being together in a library. So they are basically in front of the computer working, and they are like seeing each other working. So I think it's funny, but it's a good reason to be like motivated to work. So thank you for watching and for listening to me. I'm sorry if I talked too much, but it's over now.
No, thank you so much, Clémence. It was amazing.
You're welcome.
Now we are going to have our question time from the questions that you guys have sent us through the forms that we have sent, the subscriber form. So the first question is to all countries. How did you manage to contain the increase of cases and maintaining the economy stable? If negative, how are you dealing with it? So this is our first question. Who would like to answer first?
I think Faissal maybe should answer, and we can answer in order of the presentation.
Yeah, perfect. Okay. So Brazil is kind of in a political crisis right now. So we're dealing with many variables right now to deal with the economy, politics, and this pandemic. So the measures that the government are taking to try to minimize the impacts are try to incentivize local consumption, so from local stores. So not only use like large supermarket brands and bigger stores, but try to use local markets so they don't go out of business. The delivery system is really exploding right now. We have some big brands behind it, mainly iFood, Happy, and others. And they're trying to reach out for some businesses that were not open for delivery systems and try to offer this option for them so they can not go out of business. But we are dealing with some epics right now because many people are getting out of jobs. They're being fired because many companies don't have money to pay them. So we're trying to minimize risk, but we are very conscious that we are getting into a very steep economical crisis.
In Italy, the government a few weeks ago released a 55 billion euro stimulus pack that helps a lot of different utilities, such as private companies, but also workers. So in May, workers at the beginning of May, workers that works in factories or in small businesses received a 500 euro incentive, and at the end of the month they received 1,000 euro incentive, which will help to maintain a stability, economic stability in the country. Something that Italy is really worried about, and they're also working through, is tourism. We know Italy is a very important tourist destination. It makes 10% of our whole economic pill, and so it's very important to maintain. And the government is quite positive that there'll be ways that we can incentivize tourism, especially for Italians. So they're trying to suggest to the population to stay in Italy and visit Italy more rather than going in foreign countries. And so this is something that's very important for Italy, and the government is trying to fix this by putting money in the system to stimulate the economy. Yep.
So Switzerland did the same thing. So they've dedicated it's around 40 billion francs, which is like this almost the same in dollars. And I think that it's more money now, but I'm not sure how much they've expanded it by. And yeah, the money is being used for different things. So, for example, you can get loans if your business doesn't have enough money anymore. You can get a replacement for your lost wages, and it's not as much as you would have earned, but it's still some money. Yeah, and also we have this system in Switzerland, which is called short time work, where you can, if your employer doesn't need you for 5 days a week, because right now the people don't have that much work to do in different companies, and then it can try to get that where, for example, you would only then work 4 days a week, and the employer only pays you these 4 days, and the 5th day will be paid by the government. Yeah, that's kind of what they're doing.
So in France, government is helping a lot, as in Switzerland, I think, because as I said before, a lot of people were in short time working, and France is paying for them. It means that France is giving money for the people that are in short time working. And also another measure is that for people that have a very low income, they are giving 100 euros per child in order to help the people to feed their family and their children. Another measure is that they unlock millions of euros just for that. So to help people consume and go to the grocery shopping and feed their children. Another thing is that the companies it will be okay them to defer the payments of their taxes. I don't know if you understand, but it means that they are not forced to pay right now because it's a situation that is really complicated. So they will be able to pay the taxes after all of that. So I think this is a great measure. And I think there is another thing. Let me check. There is another fund of solidarity that is 7 billion euros that will go to little companies that are just micro companies. I don't know if you can say that in English, but it's in order to compensate the months of April that was a catastrophe for these people, for these companies. So I think that's it.
Okay, thank you. Question number 2 is to Italy and France. Did your country receive any help from the European Union during the coronavirus crisis?
So the European Union and Italy have been having some disagreements as of late, but a stimulus pack was made by the Union. 750 billion euros were put out by the Central European Bank. Those are bonds, so they are loaned money. So essentially, a country can decide to take some of the money, but then in a few years, they have to give them back with a certain interest. The interest is low, it's 0.1%, so it's not that bad. However, Italy wanted a more cooperative approach. And by cooperative, I mean that the Prime Minister proposed the so-called Corona bonds, which essentially there are bonds that can be shared equally through all the countries of the European Union to help to moderate the economic impact and the crisis impact that's having on Italy and other countries. But this was, it was rejected by several countries. So now there are those 750 billion euros, which can be used by the countries, but you have to be careful. So they're there as a safety net, I would say. So I would say that Europe did something, but there's still work to be done.
So I found the exact same information about the 500 billions of euros that the European Union can give as a help for the countries, and I would not be able to explain better than him. So I think that's it.
Okay, so we're going to pass to question number 3. Question number 3 is: were medicine students in Europe allowed to graduate earlier than they predicted because of the COVID-19 crisis, like we had here in Brazil? Some medical students were able to graduate earlier.
Ramona, would you like to start, or?
Yeah, sure. For me, it's easier to know. They still have to take the state examination, and they can't get their certificate earlier.
In France, the answer is no as well. It's not possible. They just will be graduated on time like it used to be before. It doesn't change anything.
And in Italy, the graduations are being postponed. So, some of them are being done online, but most of them are being postponed. The universities are quite strict on this, both the private and the government and the universities. Yeah.
Okay, thank you, guys. Question number 4, which I think it's a really nice question. It's for all countries. What impact does the COVID-19 will have in future doctors, in your opinion? Who would like to start?
Maybe I'll start.
Okay.
I really think this pandemic gives a kind of perspective that many doctors right now haven't even had the opportunity to experience, because this is really the first pandemic of this century, right? So we are experiencing a new kind of pandemic, I'll say, because we are in a globalized environment. So the past pandemics, so we can talk about the Spanish flu and others, but we were not in a globalized environment. We have traveling from São Paulo to the US in a couple of hours was not possible. So with this globalization and this transfer of information as well, we have to deal with a lot of variables as information and new papers and governmental policies. So I think the future doctors will have a much more reliable set of experiences to deal with future problems and future pandemics. So that's my opinion.
I completely agree. I believe the same things, and I just would like to add that this gives us a lesson. This situation gives a lesson not only to the medical practitioners and healthcare workers, but in general to politicians and the population about the situation and how ready we have to be in order to tackle it. So there are some small countries like, if I'm not mistaken, Puerto Rico, that they managed to close the borders before all other nations did. But by closing the borders, I mean they didn't have contagion at the time. So they saw that Italy and other countries were being overrun. So the governor decided to close the borders to anybody in order to prevent any spread. So that should be a tactic that, you know, the government should maybe take in a future event, I would say.
I also agree with what they said, and I don't really have a lot to add because, yeah, but I would say that, yeah, it really teaches you like to be grateful for the freedoms we have, yeah.
I have to add something. So, as I am not a medicine student, I asked this question to Dorian, and he said that we should consider that all doctors should be trained in the management of disaster medicine in order to control a massive influx of patients. And he said other things, but you already said it, guys, so I will not repeat it again. But I think that's interesting. Like, there is not a lot of lectures on management of disaster medicine, as I know. So I think it would be a great thing to learn for these medical students.
Yeah, I think what you guys said was perfect. I think it's really important for us all medical students have a great education in emergency medicine, so in case of this happening again, we are prepared to deal with it. So question number 5 is to all countries. How do you think the day-to-day life is going to be after the pandemic, thereby phase 2 of the coronavirus crisis?
Okay, so let's go by the order. I really do hope that we change our daily lives and be more conscious about not only the coronavirus, but other diseases. So I may say for Paraná and Brazil especially, we have lots of endemics. So we have some diseases that are particularly important in some regions, as we have here dengue, which is a tropical disease, which has as a vector a mosquito, which it's our historical problem, and we have a lot of deaths. There was a huge campaign in the beginning of the pandemic where they were saying that there were more deaths by dengue than by the coronavirus, but soon this changed. But we do know that after the pandemic, the deaths will rise again. So I really do hope that this experience affects our daily lives for the better. But I do think that some people might forget this in the long run.
So something that I've been thinking a bit about is the use of masks. We know that in Europe, but I believe also in Brazil, people do not go around wearing masks every day, as they may do in Japan. We know that in Japan and China and Southeast Asia, wearing masks is much more of a routine. So I don't know. I'm not sure that in Italy there will be a trend of wearing masks. Maybe. As of now, there are some trends in the sense that some masks have, flowers or some colorful patterns, and they're being worn as a fashion sort of a trend, which is, it's cool on one side and it's efficient on the other side. So I think that's very interesting. But I don't know. I think that there might be a trend of wearing masks in Europe for maybe the next year or so, because the pandemic won't go away in a month or two. I mean, it's going to stay around for a while. So I think that's going to be probably a trend that will develop over time.
For me, I think this pandemic has helped a lot of people because it has helped people to stay at home, not to travel everywhere all the time, and take time for themselves, like doing things you never do, like mask, baths, yoga, and all the things. It's also something that has helped us to go back to the basics. For example, like you really know who are your friends, you really measures how much you miss your family also. So I think it will help us realize how much little things are really little things that we take for granted are not, and that we need to appreciate them more. And also it has helped in France to rediscover solidarity, because people tend to be a bit individualistic, and I think that this situation has like helped people to take care of the others and organize things to help the other, gave money and everything else. And also I think that it has helped people to think and really know what they want for the future. Like, I don't know, maybe changing paths of study, maybe change of work, and maybe want to go abroad to work or stuff like that. I talked a lot with my friends about that, and some of them changed their paths, their change, like they changed what they wanted for their life. So yeah, I think it has helped a lot.
So in Switzerland, we're kind of like in a phase 2 already, because a lot of the things, the stores have opened and the schools have opened. And yeah, I think it's kind of weird getting used to like a more normal daily life, to see people again. It's kind of really weird. And talking about the masks in Switzerland, it's kind of like a problem, because the government has advised you to, in public transport, where if there's a lot of people in the public transport, that you should be wearing masks. But not a lot of people are doing that, and not a lot of people want to do that. And yeah, but I don't know, maybe they will get more aware of wearing masks, and I don't know. I think it really teaches you to be more conscious of your health and how to say, like, yeah, how to keep up the hygiene that you should have.
Okay. Now we're going to the 6th question. The next question is just for Switzerland. So the question is, even though Switzerland has borders with countries that had a lot of complications with the pandemic, how did your country manage to maintain low numbers of infections and deaths without calling for a general lockdown or enforcing the rule of wearing protective equipment such as masks? Ramona?
So I think it's a really difficult question to answer, because there's a lot of factors going into that. And also in the beginning, Switzerland was actually one of the most affected countries if you look at it like case per population. And the government has also been criticized for acting too slow, for closing the borders, especially to Italy, too slow. But yes, we still didn't have, sorry, Francesco. Yeah, but we still didn't have that many cases in comparison to other countries, like in the end now. I think it has to do with like testing, that we do a lot of testing in Switzerland. And also we didn't have like the actual lockdown where you had to stay out of your home, but still a lot of people did do that, even if they didn't have to. A lot of people work from home. A lot of people tried to keep their distance, especially people with risk factors were advised not to go shopping, not to go out, to stay inside and get a family to get them groceries. Yeah, I think these are some of the factors, but there's probably still a lot more. Yeah,
it's a tricky question. So our last question to finish is for Italy. So the question 7 is: did primary care play an important role to low death and infection rates? How can your country be used as an example? Francesco?
Yes, so primary care, I think all around the world, has been the foremost important factor in combating the epidemic and pandemic. In Italy, it was very important because the healthcare system, Italian healthcare system, was very fast in organizing facilities and in being efficient in organizing also the individuals that have to be treated. Something that I want to mention a bit more clearly are the healthcare providers that visit patients on a daily basis. You call them general practitioners. Those were the ones that would advise the patient to go to the hospital if he had the symptoms, and they were the ones that were most at risk. And something that happened in Italy were that those individuals, those doctors, didn't have enough protective gear or PPE, personal protective equipment, and many of them were infected. In Lombardia alone, there were 2,000 general practitioners were infected. In my city, in Brescia, around 350 were infected. And we can extrapolate that the death ratio being a 10% death ratio, a small amount of them have unfortunately died. Something that I'd like to express is that next time, or if there is a next time, increase the protective gear. And the regions in Italy have implemented this now. I mean, one and a half months later from the beginning of the pandemic. But yes, this is something that unfortunately happened. However, I'd like to compliment the whole health system in Italy. It's been very efficient and in helping in preventing further deaths. People were working 20 hours, 24 hours a day without stopping. A lot of motivation was put into helping and curing people. And my neighbor is a general practitioner, and every day she's been going to her lab to visit patients. And she's very motivated, and she sort of represents the rest of them, of this group of people and doctors that are fundamental for our health system. Thank you for the question.
Okay, thank you guys so much for the presence of each one of you and sharing the reality in your country. To finish, I would like also to thank Andressa Becker, Giovanna Knab, and Valeria Villegas, which are my colleagues from IFMSA Brazil FPP from Faculdades Pequeno Príncipe. They really helped in other parts of the webinar, so I would like to thank them and all of our special guests that were here before. I would also like to say that for the declaration of participation, the certificate of this webinar, you have to answer this form that will put in the my screen in just a second, the QR code. So you can scan it and answer it, and then your certificate will be sent by email. So I'm going to put the QR code, and then you can scan it and answer the forms. So we can give you guys your certification. Where it is. Yeah. So this is the QR code, guys. So I hope you can all scan it. And today, while you guys are scanning the QR code, I would also like to say that today is Francesco's birthday. So I would like to sing happy birthday to Francesco, and also thank him for being in his birthday, like doing this webinar with us. I don't know how to sing happy birthday in Italian, but Faissal, if you can help me sing in Portuguese, that would be great. So in Portuguese is parabéns pra você nessa data querida, muitas felicidades, muitos anos de vida. Viva Francesco! Yay! Happy birthday!
Thank you, guys.
Yeah.
So nice.
Okay, so I think everyone can have already scanned. Otherwise, this link to the forms will be available in the website of